Update on COVID-19 in New Brunswick. Bon après-midi, tout le monde.
Good afternoon, everyone. Welcome to this update regarding COVID-19 in New Brunswick.
Province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Les porte-paroles aujourd'hui sont
Spokesperson Jennifer Russell and the Honorable Dorothy Shepherd, Minister of Health.
Bon après-midi à toutes et à...
Good afternoon, everyone.
Comme vous le savez,
So as you know, since the beginning of our pandemic, I've announced sometimes some bad news to the people of New Brunswick. I've informed you about high numbers of cases and concerning numbers of hospitalizations. I have had to announce restrictive measures, including lockdowns in some health zones. At times, I have shared condolences with New Brunswickers who were grieving a loved one who was tragically lost as a result of COVID-19. In recent weeks, however, we have seen the tide begin to turn. And as our drive to 75 continues, I'm delighted to be able to deliver more uplifting news. It's with great pleasure that I'm announcing that there are no new cases of COVID-19 here in the province of New Brunswick since the last 9 days.
there have been times when I have had to deliver difficult and disappointing news to New Brunswickers. I have informed you about high numbers of cases and concerning numbers of hospitalizations. I have had to announce restrictive measures, including lockdowns in some health zones. And at times I have shared condolences with New Brunswickers who were grieving a loved one who was tragically lost as a result of COVID-19. In recent weeks, however, we have seen the tide begin to turn. And as our drive to 75 continues, I am delighted to be able to deliver more uplifting news. Today, I am pleased to tell you that it has been 9 days since New Brunswick last reported a case of COVID-19. Santé publique ne signale aucun nouveau.
Public Health does not announce any new cases here today. There are only 2 active cases in the province right now. No New Brunswickers are currently in hospital due to the virus, and this is the first since mid-January.
Cases today of COVID-19 in the province. There are now 2 active cases of COVID-19 in the province. No New Brunswickers are currently in the hospital due to the virus, and this is the first time since mid-January that this has been the case. As a province, we are making incredible progress, and I'm very encouraged by the number of people who have chosen to be vaccinated. Currently, 53.5% of eligible New Brunswickers are fully vaccinated, and 79.9% have received their first dose of the vaccine. We are well on our way toward the green level. À ce jour, 53.5%.
53.3% of people have received the vaccine, and 79.9% have received the first dose. We're on the right track, in fact, to get to the green phase.
And our journey through the pandemic is not yet finished. Right now, our case numbers in New Brunswick are very low. But with our travel restrictions now loosened, there are opportunities for the virus to enter our province. COVID-19 cases are rising again in many parts of the world. And all viruses change over time, and most of these changes have little to no impact on the properties of the virus. Well, actually, that's not true. Sorry. All viruses do change over time. And in COVID-19 in particular, we are seeing variants of concern and variants of interest emerging. So the variants are affecting how easily the virus spreads and how severe the symptoms can be. Research shows vaccines are effective in preventing severe disease, even against the variants, rather. A study conducted in Ontario on the effectiveness of the Pfizer-BioNTech and Moderna vaccines showed that vaccine effectiveness for those who were partially vaccinated was substantially higher against severe disease than for those who were unvaccinated. It also showed that getting your second dose greatly improves vaccine effectiveness against COVID-19 variants. We have evidence that vaccines are working, and that's why it's so important that we all do our part by getting fully vaccinated. If you have received your first dose of a vaccine but have not yet booked your second appointment, I encourage you to do so. Même si vous devez attendre 28 jours,
Even if you have to wait 28 days in between doses, you can still have an appointment for the second dose right away. Simply make sure that there are 28 days after your first dose. To get an appointment through Horizon or Vitalité, you need to visit www.gnb.ca/book a vaccine. You can also book an appointment through a participating pharmacist.
doses, you do not need to wait 28 days to book your appointment. You can schedule your second dose today for an appointment that is 28 days after your first dose. Appointments can be booked at a Horizon or Vitalité Health Network clinic by visiting www.gnb.ca/book-a-vaccine. You can also book an appointment through a participating pharmacist. Mobile clinics are continuing to offer walk-in appointments in communities throughout the province, and Minister Shepherd will have more details about that in a moment. When you do go to your vaccination appointment, please be patient and kind with the healthcare workers you encounter. They are working hard to protect us, and they deserve our utmost respect. And I would also encourage you, if you are the close contact of a case, or you are somebody who's self-isolating and you are dealing with our public health staff in the regions, please be kind to them as well, and please be patient. Earlier this week, many of us have heard a comment from the World Health Organization scientists regarding the interchangeability of vaccines. As the scientist later explained, her concern was that individuals should not decide for themselves which vaccine to take and when they should receive it. Instead, they should listen to the advice of public health officials. Plus tôt cette semaine, une scientifique
Earlier this week, a scientific from the World Health Organization made a statement regarding the interchangeability of the vaccines. As the scientist later explained, she was concerned that individuals should not decide for themselves which vaccine to take and when they should receive it. Instead, they should listen to the advice of public health officials.
We are continuing to follow the advice of the National Advisory Committee on Immunization, which supports following the AstraZeneca vaccine with an mRNA vaccine, either Pfizer or Moderna, as well as mixing of the Pfizer, BioNTech, and Moderna vaccines based on whichever product is currently available. While we have been receiving fewer doses of Pfizer BioNTech vaccine than expected in New Brunswick, we did receive 18,720 doses last week, and we are scheduled to receive 29,250 doses this week. We are using Pfizer BioNTech to vaccinate children aged 12 to 17, as this is the only vaccine approved for this age group. In the week of July 19th, we expect to receive our full shipment, 64,350 doses of Pfizer BioNTech, and we are anticipating another shipment of 76,050 doses during the week of July 26th. We are not anticipating a shortage of this product, and we will continue to offer it and Moderna at our vaccination clinics. I advise against waiting or vaccine shopping to receive a certain brand of vaccine regardless of which vaccine you received for your first dose. Canada is one of the many places that has safely and effectively administered vaccines interchangeably, along with countries such as the UK, Spain, and Germany. This strategy has allowed us to quickly vaccinate more people, protecting us all from the imminent threat of COVID-19. Thanks to this approach, each week we are getting closer to green. As our number of active cases continues to decline, we can see that our drive to 75 is working. So, don't put off your vaccination appointment, book it today, and encourage the people in your life to do so as well. We are now in the final stretch on our path to green. We will make it to the finish line by continuing to work together to protect ourselves and our loved ones. Thank you very much.
Good afternoon. Bonjour. You know, it's exciting to be able to come to you here in these recent weeks and share the latest COVID-19 vaccination numbers with New Brunswickers. Because along with those steadily increasing numbers, we are giving the people of this province hope. And after the challenges of the last year or so, hope is something that we can all use. Together, we have done what is needed to be done to get our province to this point. Be proud of the hard work that you've put in. I know a lot of you are ready to take that next step, to get to green. You look around and you see what other provinces are doing, and you want us to do that as well. And I understand we're all anxious to return to a sense of normal, but we've gotten where we are today by listening to public health, and that is what we must continue to do. Working with public health, we created our path to green. And as we've reached set goals along that path, we have loosened restrictions. Think about how far we have come since the pandemic began. Currently, in Phase 2 on our path to green, we are able to have contact with all our family and friends. We are able to welcome our family and our friends from other provinces with vaccinations or isolation guidelines still in place, and we can plan trips of our own outside New Brunswick. Masks are not required outside in our province unless you are in a public space and unable to maintain 2 meters of physical distance. We are making great progress. It is wonderful to see New Brunswickers enjoying somewhat closer to normal activities and sampling what summer in our province is all about. We worked hard to get here, but it is important to remember that we are not quite there yet. As Dr. Russell said, the variants remain a concern, and that is why it is imperative that we continue to follow the advice of public health. It's also why everyone who is eligible to do so must get vaccinated as soon as possible. As of today, 53.5% of our New Brunswickers aged 12 and older have received both doses of a COVID-19 vaccine and are now fully vaccinated. As well, 79.9% of eligible New Brunswickers have been vaccinated with at least 1 dose. This is something to be incredibly proud of. I want to thank every New Brunswicker who has been vaccinated, as well as those who have booked an appointment to get vaccinated in the days and weeks ahead. You are taking the steps necessary to protect yourself, your loved ones, and your community. If you haven't had the chance to book your appointment yet, now is the time to do so. We have lots of availability. You can book an appointment for your first or second dose through Horizon and Vitalite Health Network clinics by visiting www.gnb.ca/book-a-vaccine or by contacting a participating pharmacy. I want to say a special thank you today to pharmacists and pharmacy staff across our province as we expected to record the 400th dose administered by our partners in pharmacies as early as today. Thank you for helping us reach this impressive milestone. To further support those who want to receive their first or second dose of a COVID-19 vaccine and haven't had the opportunity to do so, we have launched a series of mobile clinics. These pop-up clinics provide walk-in service, making it easier than ever for eligible New Brunswickers to get vaccinated. 5 clinics were held across the province last week, and of the more than 1,500 people who came out of the mobile clinics to get vaccinated, 20% were receiving their first dose. That's a great job. We welcome those who are receiving their first dose, as well as those who are getting their second dose. 7 more pop-up vaccination clinics are being held this week, including clinics tomorrow and Friday. Tomorrow, there are 2 clinics taking place, including one at the River Valley Civic Centre, 11 School Street in Perth Andover, between noon and 6 p.m., and another at the Dorchester Veterans Community Hall, 4955 Main Street in Dorchester, between 10 a.m. and 4 p.m. On Friday, there are also 2 clinics taking place, including one at the Tobique Lions Community Centre, 61 Everett Lane in Plaster Rock, between the hours of 10:30 a.m. and 4 p.m., and another at the Salisbury Baptist Church, 3128 Main Street in Salisbury, between 10 a.m. and 4 p.m. If you are in these areas, please go to a clinic and get vaccinated. We will be offering more pop-up vaccination clinics across the province next week, and we'll share further information on the locations and the times of the clinics as soon as details are available. Working together, we will reach our goal of fully vaccinating 75% of eligible New Brunswickers. But to get there, we all need to do our part. If you haven't been vaccinated, please book your appointment to do so. When you do, let your family and friends know that you are taking this important step to keep our province healthy and safe. As a province, we have done a great job. We are so close to the finish. Now is not the time to falter. Let's dig deep, find that final burst of determination, and get New Brunswick to green. Thank you. Merci.
Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup à vous deux. We will now proceed with questions from the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Maintenant, nous allons procéder aux questions des journalistes.
Now we will be going to the reporters' questions. You can ask the question in the language of your choice. Each reporter will have one question and one follow-up question. Please make sure to turn off the sound of your microphone. Laura Brown, CTV.
Hi, Dr. Russell. I'm wondering if you have any advice for families who plan to travel this summer with children who are below the age of eligibility for vaccines.
Well, I guess what I can say, Laura, is that, again, everybody has to make their choices as a family, as individuals, with their own safety in mind and their loved ones in mind. So really and truly, all I can say is to follow whatever advice is at the local area where you're traveling to, and use caution when you're traveling. Again, if you're vaccinated, that's one thing, but obviously if your kids are at risk, then you still want to keep them protected as best as you can. So yeah, again, I think individuals have the choices to make for themselves and their families and their loved ones. And again, whatever places, destinations that you're traveling to, as long as you're following the public health advice where you are, and then following them back when you return to New Brunswick in terms of the criteria for isolating, etc.
Thank you, Dr. Ms. Brown. Do you have a follow-up?
Yeah, very quickly. Minister, I'm wondering if you could maybe tell us a little bit more about the 6 access open mind centers for youth suffering from mental illness.
So I believe that we've already confirmed bridge funding. Where there is more collaboration that needs to be done going forward. This was essentially a project that began 5 years ago as a research project. And so, as always, when those monies run out, provinces have to decide how to transition that. The most important thing I can say to this is that I'm excited because I think that the Access Open Mind Centers have proven that they're very they're very effective in the delivery of care and service. And so we want to enable that. But I also want to know that when we're dealing with community partners, I think it's really important that everyone see themselves as something bigger than themselves. We need to start integrating not only our RHAs, but our community services so that they're almost seamless. We need to be knowing that our resources are being used not only in a frugal way, but in a way that delivers the best service that we can all deliver. That takes partnerships, and that partnership with Access Open Mind is certainly a promising one in my mind. And I think that we need to go further with making sure that we're integrating our services together.
Thank you, Ms. Brown. Thank you, Dr. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, the World Health Organization's chief scientist's words about mixing vaccines were taken out of context, but are you concerned that recent news headlines that suggest mixing vaccines is dangerous have deterred some New Brunswickers from getting vaccinated with a second dose that's different from their first?
Well, Vicky, what I do know is that, again, throughout the vaccination rollout, early on, certainly we had access to more doses of Pfizer than Moderna, and that brand recognition did impact people signing up for Moderna clinics. However, throughout the rollout, again, as we know that NACI supports the interchangeability, we are trying to encourage people. I don't have firsthand knowledge or data on people canceling or switching or being hesitant, but certainly anything that reassures people at this point in time is helpful. And again, our messaging is that we are continuing to follow the National Advisory Committee on Immunization recommendations around the interchangeability. They're saying to not wait, and meaning don't put off getting that second dose if another type of mRNA vaccine is available. And that is really helpful in terms of the thought and strategy that has been put into our rollout plan. And obviously getting our population protected at the 75% level with 2 doses as soon as we can, then again, it helps us on our path to green.
Ms. Hogarth, do you have a follow-up?
Yes, thank you, Bruce. Dr. Russell, when we reach our reopening goal and restrictions end, will you still encourage non-vaccinated people to wear masks or take greater precautions?
Well, I guess the other good news item that I think Minister Shepherd might have spoken to in her points is around the fact that the mobile clinics are helping people get their first doses who may not have otherwise gotten them. We do want the number of people vaccinated with 2 doses to be as high as possible. I mean, 75% is a target, but certainly the more of the population that is vaccinated with 2 doses, the better. It is difficult to predict what's going to happen in the fall with respect to the variants and with respect to surges in cases. And again, those people are most at risk for hospitalizations and severe outcomes. So whatever protection they feel they're going to need once the mandatory order is lifted and at the population level we feel protected, individuals will have to make choices about what they need to do to protect themselves. And certainly if they haven't been vaccinated, obviously wearing a mask is one of those tools.
Okay. We're just going to, Minister Shepherd would like to add to that. Stand by.
Yeah, just to add to what Dr. Russell has said, I think it's, pop-up clinics have really played a valuable role here. And I think that it's important to note that 20% of total administered doses have actually been first dose. So that's really important. Yesterday in Hillsborough, 31% of the doses were first dose. The pop-up clinic in Fredericton saw 20% first dose, and Saturday's clinic at the Dieppe Bolorama was 21.5%. So the pop-up clinics are playing a role in reaching people who haven't gotten to an RHA or pharmacy clinics. So we think that this is a tool in the toolbox, and we're going to continue to use it.
Thank you both. Andrew Waugh, Brunswick News.
Yeah, Minister, I'd like to just follow up on your last comment there. Those percentages sound really impressive. Can you give us some numbers with that? I'd like to know what those 20 and 30% figures actually represent in terms of people.
Well, what I can tell you is that 1,818 doses were distributed at 9 pop-up clinics. And so those percentages would equate to that number. I visited the Nick Nicole Center in the north end of St. John yesterday, and there was about 100 people who came forward to be vaccinated. Many of those individuals were first doses. And anecdotally, I can say that in speaking with a few of the people who came, they wouldn't have come if it hadn't been in their community. Some were newcomers, many were newcomers. And so there's a trust factor that putting a pop-up clinic in their community really helps to bridge those worries.
Mr. Waugh, do you have a follow-up today?
Sure do. So I'm not sure who wants to answer this, but the 75% numbers, obviously those targets were set before the Delta variant had become as widespread as it is. Now there's several countries and experts saying 75% might not be high enough. Are you worried about that? Or should the targets be, set a little bit higher?
Dr. Russell will start.
So Andrew, that is correct. The targets have changed a few times, actually. I feel like at the very beginning of the discussions about vaccine rollouts, it was low as 60 or 65%. So the variants of concern that exist today are concerning, but we also know that there could be some newer variants as well that will emerge. So whatever the highest level we can get to is better protection for the population, no question. But in terms of, the restrictions that we've all had to live with as a population, again, it's all about protecting our hospital system and preventing our ICUs from getting overwhelmed, and that will continue to be the goal. So however things emerge and evolve, that will be the focus, and we need to continue to look at our testing numbers as well as vaccination rates as we move forward in terms of, protecting the healthcare system.
I'm just going to add to Dr. Russell's comments and just say that we've never lowered the bar. we are continually encouraging everyone to get tested, and we're a smidge away from 80%, which is incredible, I think, in light of, in light of asking our population to step forward. There's nothing that says that's not going to continue to go up in increments, just as it has from the 75%. And we're going to continue to encourage that. We believe that every single New Brunswicker who can be vaccinated should be vaccinated, and that's the message that we'll continue to encourage.
Thank you both. Thank you, Mr. Wass. Silas Brown, Global News.
Hi there. This is a question for Minister Shepherd.
A little louder there, Silas. Can you just get a little closer to your mic?
Sure thing. How's that?
A little better. Keep going now.
All right. I've been speaking to some of the mayors in the areas affected by ER service reductions, as well as the nursing union, and something that has stuck out to me is what exactly is going to change come September, other than obviously there not being as much pressure from vacations on the system, but what is going to change to ensure that these service reductions are temporary or aren't going to happen in other places? As the nurses union has said, the nursing shortage is getting worse, not better. So what else is going to happen come fall that is going to ensure that these don't continue or become more widespread?
Well, I've never indicated that fall will bring an end to all of our challenges. In fact, I've said repeatedly that these challenges are not going to be overcome overnight. And I think it's really important to understand how we've gotten to some of this. And this is going to be a lengthy answer, so I hope you don't mind. But I'm going to talk about nursing enrollment numbers in our universities. And I just want to say that from 2009-10 to 2013-14, there were 5,517 enrollments for an average of 1,339 enrollments per year. From 2014-15 to 17-18, that dropped significantly to 4,069 for an average of 1,017 per year. That's 362 nursing students that we lost over that time. Let's say we take out 10% for people deciding they didn't want to continue in nursing or family reasons or whatever, someone might not continue in nursing. 362 nursing enrollments per year we lost during those 4 years. That would be a significant help if we'd had those. Now, having said that, we don't have those, but the numbers are growing again. And as of the 2021 projected enrollment of 1,062 has come up from a 2018-19 low of 888, or actually that was in 17-18 as well. I think that we are going to see that we're going to have more nursing students to have, which is going to help the situation incredibly. We've been working on internationally educated nurses, and that, having put in a nurse navigator, has really helped. And how I'm going to describe this to you, single-digit numbers of bringing in internationally trained nurses from years previous to this year, single digits, under 10 per year. This year, we're at 72. So we're not standing still, we're moving forward. This year, Horizon has hired 106 new nursing graduates, the majority of which are New Brunswickers and staying here. And I think that it's really important to know that Vitalite has also recruited 100 nursing students. Now, we know we have to factor in retirements. None of this is a switch. It is an evolution, but we are digging deep and we are working really hard at getting nurse recruitments. As with other medical professionals, the shortage is not for New Brunswick alone, but now that we've seen where we've been, we know where we need to go.
Thank you, Minister. Mr. Brown, do you have a follow-up?
Yes, I do. Thank you. With all of that in mind, and looking at the fact that nursing vacancies have actually position vacancies have actually grown over the last several months, would you expect this situation with service reductions and that sort of thing to continue to get worse before it gets better, as all of these sorts of measures that you're talking about really start to yield benefit?
I think that answer is twofold. I think the RHAs are watching this situation very, very closely, and nobody wants to put a limitation on services. But if we have to alter surgical schedules, we're going to go to the front lines and ask them how we do this. If we have to alter, an ER schedule for a short amount of time, we're going to ask our frontline workers, how do we deal with this situation? This is really important in engaging with your human resources to help through a challenging time. There isn't a medical professional in this province that doesn't understand we have challenges, and I believe we have medical communities who are really ready to step up and help us get resolutions. I can't say it's going to get worse before it gets better. It might stay the same. We're going to see as this evolves, but the fact is that we're going to work with our nurses union, our MBMS, our all of our unions to try to ensure that we're approaching this in the best way possible. And I believe we can do this together.
Thank you, Minister. Thank you, Mr. Brown. We're going to go to Michel Corriveau avec Radio-Canada. Michel.
Merci.
Thank you, Bruce. This is a question probably for the Minister of Health. There are many New Brunswickers already who are traveling. Will there be a form or another of passport regarding the vaccine against the COVID-19?
Question. I read recently, yesterday, I believe, that the Prime Minister said that any domestic passports would be the intent of the provinces. And to my knowledge, the province of New Brunswick is not considering a domestic passport for vaccines. I believe that, we have a pretty good relationship with our partners across this country. And I think that, Canada leads, is a leader in the world for getting our population vaccinated. And I think that we can do without a vaccine passport on a domestic level.
Monsieur Corriveau, as-tu un suivi?
Oui, donc pour...
So, if one travels, when we need the proof of vaccination, someone needs to bring the 8.5 by 11 inch paper that they got.
Vaccine certificates with you. However, as you know, earlier this week on Monday, we began giving out passwords so that people could register for eHealth, My eHealth NB, which I believe is, I think, going to be an evolution into bigger things for our healthcare system, if I may say. But the fact is that will give you access to your electronic record of your vaccinations. So I think there's many ways for people to address this. Access codes are coming out to the end of this month, and we're going to continue on with this program because I think it's really important, one, that people have their health information at their fingertips when they want it, and I think that can play a big part in our healthcare system going forward.
Merci beaucoup, Michel. Merci, Madame Ministre. Jordan.
Yes, this question's either for the Minister or for the doctor, either one. Can you please clear up something about the green phase? Will anyone or any business be allowed to ask employees or customers for proof of vaccination?
Stab at this and just say that we're still working with public health and public safety and government with this, and I don't know that there's been a decision. I think that private businesses certainly have a good bit of latitude, but I don't know that there'll be any directives from government that will address this. So I'd have to get back to you with more information on that.
Mr. Gill, do you have a follow-up?
Yes, I do. This one's for Dr. Russell. What can you tell us about the vaccine holdouts in terms of where are they? Is the province targeting specific neighborhoods or postal codes with low first dose rates? And how is the province deciding where to offer those pop-up clinics?
The vaccine task force has a lot of the information and the surveillance data in terms of where people are in the province, and actually they're consulting with the regions as well. So it's a collaboration in terms of making those decisions. There are a lot of different things they take into consideration, but certainly, again, at the foundation of all that is making sure that there's access and improving that access, again, with the help of our collaborators, Extramural, Ambulance New Brunswick, and the RHAs, making sure that people do have those opportunities, especially for people who haven't had their first doses yet.
Add a little bit to that. I think it's important to know that we've been in almost every single community, but this is about just going the extra distance on our part to try to make sure that we're getting as close to as many people as we can. And I just will take the opportunity to tell you that, there's a clinic taking place today in St. John in the Crescent Valley area. Appointments can now be booked for clinics scheduled for Friday, July 16th in Bathurst, Tuesday, July 20th in Miramichi, Campbellton, Thursday, July 22nd in Fredericton, Friday, July 23rd in Moncton, and Wednesday, July 28th in St. John. And the pop-up clinics are meant to support these and just go the extra mile so that we can make it as convenient as possible for people to get their vaccinations. I said that the clinic was happening today in Crescent Valley. I'm going to correct myself and tell you that's a pop-up clinic happening tomorrow in Crescent Valley.
Thank you, Mr. Gill. Thank you, Doctor, and thank you, Minister. Jean-François Boisvert, l'Acadie Nouvelle.
Yes, good afternoon. My question is for Dr. Russell. You have mentioned during your comments that many provinces have gone on to other steps, including putting aside the mask, still being far away from the figures here in New Brunswick, which are so positive. So why not imitate them and suggest a summer without a mask during the summer? This is something that would be decided by government. At this point, in fact, we're continuing with the vaccination program that we have in place, and all the various measures will be maintained up until we reach our goal of 75% of people who have received the second dose. Mr. Boisvert, would you have a follow-up question? Yes. So probably we will reach 80% of people vaccinated today vaccinated with one dose. That being said, when you look at the last 5%, they were hard to reach. What would be your goals over the next few weeks? Because we're talking about people who don't necessarily want to be vaccinated. Is there something to convince them to get vaccinated and target them a little more, if I might say? In fact, we have got a lot of information who do not get vaccinated, and we truly wanted to be able to put aside the obstacles. This is why we're talking about mobile clinics all over the province, and that helps a lot. It enables people who have not been vaccinated to get the vaccine, and I believe that 20% of these vaccination clinics, these mobile clinics, and 20% of the cases, these are first doses. So we want people to encourage their family members, friends, members of the community to get the information on the vaccine and encourage them to get vaccinated. And we can help them get there to get the vaccine, or accompany someone who's afraid of needles. If you can encourage someone, go ahead. I believe that's what we need. That's what we need in order to encourage people to get vaccinated. Thank you, Mr. Boisvert. Thank you, Madam Russell. Myriam Lafontaine.
CBC.
Hello.
Yes.
Hi. So this question is to Minister Shepherd. I was curious about the percentage of healthcare workers who have received their first and second dose, and also was wondering if the province is still considering making vaccines mandatory for these types of workers.
So I am sorry to tell you that I don't have that information here with me today. So I apologize for that. We will get you the information. At this time, we have been continuing on with encouraging in the RHAs, and certainly EM extramural and A and B have been certainly going through their own encouragement processes to make sure that we are getting as many as possible. We have not mandated at this time, and I don't think that that's going to be necessary, but we will certainly keep revisiting it to make sure that the numbers continue to go up.
Ms. LaFontaine, do you have a follow-up?
Yeah, in terms of, I don't know what the percentages are, but do you know the reasons why some healthcare workers might have not been vaccinated yet?
I do not.
We're going to go to Bobby Jean McKinnon with CBC.
Yes, hello, can you hear me?
Perfectly.
Thank you. Dr. Russell, a memo Dr. Muke sent to healthcare professionals on June 24th appears to outline some of what the de-escalation plan will entail. What more can you tell us about that plan today, and how soon can we expect it to be released?
Hi, Bobby Jean. So we are working with stakeholders around that de-escalation plan. It's not completely finalized, and so I don't have a date when it's going to be released publicly. But certainly, healthcare providers, we've had, again, many meetings with New Brunswick Medical Society, and again, we have reached out and met with different stakeholders so that they could understand what their involvement would be in the de-escalation plan.
Do you have a follow-up? Jean, Ms. McKinney,
Yes.
do you have a follow-up? Sorry.
Yes, also for Dr. Russell, are there any areas of life where you can imagine calling for continued mask wearing, such as on the bus, as some jurisdictions with even higher vaccination rates than New Brunswick are doing?
Well, Bobby Jean, at this moment in time, our Path to Green has outlined what the fact that we won't really have any public health restrictions in place at the population level. Most will be at the individual level in terms of what people consider their own individual risks to be, again, based on health status and vaccination status.
Thank you. Erica Butler, CMHA Radio.
Oh, hi there. Thank you. I'm just wondering, I've noticed that our neighbors in Nova Scotia have really pulled ahead of us in terms of first doses. Now they've hit 82% of their eligible population, even though they had a much slower rollout than New Brunswick until recently. Have you compared notes with Nova Scotia to come up with any theories as to why their first dose rollout seems to have more staying power and ours is slowing down?
I'll take that and just say that I know that public health and the premier's level, the premier's offices, we've all been in pretty consistent touch. But good on Nova Scotia for reaching 82%. That's encouragement for all of us. That we can continue to get people to come forward and get their first doses. So we're just going to build on everyone's success.
Ms. Butler, do you have a follow-up?
Yeah, just one more. I'm just wondering if there have been efforts to coordinate the goalposts for reopening with the other Atlantic provinces. We have the most aggressive plan by far, and I'm wondering if we know if we've consulted with the other Atlantic provinces, especially concerning our position in the bubble, to ensure that it won't be affected by our relatively quick opening compared to what the others have planned.
Well, I'll start, and Dr. Russell may want to chime in. But again, we're in touch with our with our sister provinces on a very regular basis, communicating to them what our initiatives are and our plans are. We put our plan out in May, made it very clear of what our goals would be and what our targets would be. And as New Brunswickers have stepped up and met those targets, we've, for lack of a better word, rewarded them for all their efforts. And so we're going to continue on that path to green, and we've done that in partnership with public health and public safety, and so we're confident about that. I think that at this point, every province is sort of working towards their own type of goals, but we're all in touch at least to know what's happening. I don't know that there really needs to be much more coordination. We're all going to get to where we want to go around the same paths and targets.
Thank you, Minister. Adam Harris, Brunswick News.
Thank you, Bruce. Question for Dr. Russell on the AstraZeneca vaccine. The federal government just donated 17.7 million doses of the AstraZeneca shot to other countries. Atlantic Canada as a whole just let about 8,000 doses expire. By the department's count, the province still has about 10,000 AstraZeneca doses that are set to expire by the end of August, and then a few more by the end of October. I just wanted to know, do we need all of these or any of those? And are we trying to give them back? Are we pretty much done with this brand of vaccine?
Dr. Russell?
Well, I can start, and then Minister Shepherd might want to finish. So based on the fact that we wanted to continue to offer AstraZeneca if people chose it, and also if people had allergies or reactions to the mRNA vaccines and needed that as an option. So we were planning to continue to offer it, and that's the extent of the information that I have, and I'll turn it over to Minister Shepherd.
So I think I can only add to that in that, AZ is very portable. And so for residents in long-term care who need to be vaccinated in an intermittent basis because of admissions and so forth, I think that AZ has proven to be a much easier vaccine to work with. So we need it for that. But once the vaccine has left McKesson medical distributor in Moncton, it can't be returned. So we'll try to be as prudent as possible with the vaccine. I think about the dosages that unfortunately had to be wasted. But when you look at the fact that we're going to be reaching 900,000 doses delivered, I think we've been very prudent with our inventory.
Mr. Harris, a follow-up today?
Yes, please. For both the Minister and Dr. Russell, we look to be about a day away from hitting 80% first doses. It took a while to get there, but it looks like it's going to happen tomorrow. By your modeling, is 85% possible? And do you see any ceiling?
Well, I'll start, and I'm just going to say that we don't ever want to see a ceiling unless it's 100%. So I think we're going to continue to encourage every New Brunswicker to receive their first dose. And, the 2 weeks getting to our 75 was a bit painful. And I just view every day that we go over that 75% mark is a great thing, and look forward to those numbers increasing. And if we can keep them going to 85 or 90 to 100%, listen, I'm going to encourage that every single day.
Thank you, Minister. Thank you, Mr. Harris. Derek Dubé, CHAUTV.
Go ahead. Perfect, thank you. Everything works? Thank you. So my question is for Minister Shepherd. Last week, in fact, you have met Égalité Santé en français, and they have mentioned, in fact, their concerns regarding your project for possibly having a bilingual healthcare network. So during this meeting, did you think, in fact, that we could have an agreement or compromises to have something in place that works well and to avoid any problems that could lead to something worse?
I emphasize that we have two RHAs, Vitalite and Horizon. I do not see that changing. And again, as I spoke a little bit earlier to the question about Access Open Minds, I believe that we all need to see ourselves as a part of something bigger than ourselves. And I spoke to a network of excellence. But that network of excellence will reside with two health authorities, Horizon and Vitalite. And those were my comments.
Okay.
As-tu un suivi, Monsieur Dubé?
Any follow-up, Mr. Dubé? Yes. So you believe in this network of excellence, as you mentioned, that both RHAs would work together. We would keep both RHAs, francophone and anglophone, in the project that you want to put in place.
Merci.
Merci beaucoup.
Thank you. Thank you, Mr. Dubé.
Ladies and gentlemen, that concludes today's update. Merci beaucoup tout le monde.
Thank you very much. This is an end to our update. Have a good day.